Greetings, my name's Heidi Conley and I'm a cardiologist in the Department of Cardiovascular Medicine and the director of the Adult Congenital Heart Disease Clinic. And I'm here today to introduce you to our Adult Congenital Heart Disease Clinic and Comprehensive Care team. At Mayo Clinic, we've been caring for patients with adult congenital heart disease really since the institution started in 1864. The institution was one of the pioneering centers for congenital cardiac surgery, starting with extra cardiac repairs in the 1940s. And it was one of the earliest centers to do intracardiac repair using cardiopulmonary bypass in the 1950s. And that means that we've been caring for patients with repaired congenital heart disease now for over 60 years at the institution. The formal Adult Congenital Heart Disease Clinic was founded by my colleague, Dr. Carol Warrens, in 1987. She's one of the pioneers in the practice of adult congenital heart disease in the world. Since that time, we've seen over 10,000 patients and see over 2,000 patients per year. About 500 congenital heart operations are performed each year by our surgeons, and about 100 catheter-based interventions are performed by our pediatric and interventional catheterization team each year. I'd now like to introduce you to our physician staff, and in alphabetical order. We have Dr. Nasser Amash, Dr. Crystal Bonnickson, and me, Heidi Conley. Also have Dr. Alexander Egby and Dr. Carol Warrens. All of us are practitioners in the Adult Congenital Heart Disease Clinic. Dr. Frank Setta, who's chair of pediatric cardiology, is also certified in adult congenital heart disease and sees many adult patients as well as working in our clinic. I'd also like to introduce you to our congenital cardiac surgical team. Dr. Joseph Deraney, who's the chair of cardiac surgery, and Dr. Sami Syed have really dedicated their careers to the practice of congenital cardiac surgery. Dr. Hartzell Schaff, Dr. Alberto Pochettino, and Dr. Sirtek Sicek all also participate in the surgical care of patients with congenital heart disease. All of these surgeons have expertise in the surgical care of adults with congenital heart disease and have focused their careers on certain aspects of congenital heart disease surgery and complex reoperations. There are many individuals who participate in the patient appointment and visit process, and unfortunately there are too many for me to introduce to you formally today. However, I'd like to introduce you to our nurse practitioner, Krista Burke, pictured here, and our 3 RNs, Caroline Arpin, Carissa Newman, and Mary Silhasek. These individuals play a very important role in the initial assessment and continuity of care for our many adult congenital heart disease patients. So the Adult Congenital Heart Disease team integrates the care of patients with congenital heart disease. This involves transitioning adolescents and adult patients from the pediatric cardiology group, providing regular evaluation with clinical assessment and cardiac imaging, and working closely with our cardiac surgeons, interventional cardiologists, and anesthesiologists to provide care around the time of interventions. We know that about 50% of patients with congenital heart disease will have a heart rhythm disturbance at some time in their life, and we now have a special team of heart rhythm specialists who have expertise in the treatment of patients with adult congenital heart disease and heart rhythm abnormalities. Many patients consider pregnancy or reproduction, and we work closely with our maternal fetal medicine colleagues and, when needed, our genetic specialists to evaluate patients before pregnancy and follow them during pregnancy and around the time of delivery. Adult congenital heart disease patients are at risk for developing problems with reduced heart function, high pulmonary or lung pressures, liver and kidney dysfunction, as well as other disorders that may require specialized care or ultimately transplantation. We're fortunate at Mayo Clinic to have specialists in all of these areas that work closely with our adult congenital heart disease team. Ultimately, however, there has to be a leader of the team, the person who keeps the wheels turning, and this is the role of the adult congenital heart disease specialist. We provide multidisciplinary lifelong care for our patients at Mayo Clinic. We're fortunate to work as part of a comprehensive care team at Mayo Clinic, which is voted the #1 ranked medical center by U.S. News & World Report in the 2016-2017 survey. Our adult congenital heart disease clinic has also received several institutional patient experience awards. However, we continue to try to improve every day. We look forward to meeting you at Mayo Clinic and to welcoming you to our adult congenital heart disease clinic, where our major focus is to provide the best patient care. We do, however, recognize the importance of education of our patients and families, as well as healthcare providers of the future, and we need to continue to research better ways to care for our patients with congenital heart disease today and tomorrow. Thank you very much.